Today, remember, is the National Doctors' Day, and the entire country is expressing their gratitude to our frontline health warriors who have been at the front line dealing and treating the coronavirus patients across. Now, remember, let's go across to the Bombay Hospital where my colleague Disha is currently joining us live from one of the COVID wards there. Disha, over to you. On the occasion of the National Doctors' Day, we of course salute the work that has been done by all the doctors across the country and their relentless effort in working day and night. Tell us about where you are and what is happening there, and in what way are we looking at this day being celebrated as well?
Well, that's right, Apurva. Today is a very special day. It is time to salute our heroes who work round the clock for us here across the country. They sacrifice their own time. They sacrifice their own time to stay with family only to help us, to save us. And this year, it's even more important to really thank all the doctors who are working here non-stop, round the clock, is only because the COVID pandemic has hit us and the life has changed for each and every doctor here for the last 3 months. Right now, as you can see, I am inside the Bombay Hospital, which is a private hospital here in the city of Mumbai, inside the ICU COVID ward. And as you can see, me and my video journalist, even we have worn a PPE kit, and so the doctors, they wear it for 8 long hours, Apurva. Let's directly go and speak to the doctors here in concern. I'm joined here by Dr. Gautam Bhansali, who's the consultant and physician here at the Bombay Hospital. He's also the chief coordinator of all the private hospitals across Mumbai. Thank you so much for speaking to us, and firstly, happy Doctors' Day. I know that it's one day is not important to celebrate what you all do for everyone, but I just want to know how life has changed in the last 3 months. What are the challenges that you all have to really face, because this particular disease was new? What exactly were the hardships initially?
See, one thing we all should understand, this is a totally new disease, and every day there are new kind of challenges are there. Every day we see the protocol we are changing, we are changing the discharge policy, we are changing the lab testing policy, we are changing the tracing policy, we are changing the that how to admit or what kind of patient we should admit. But it's a different kind of situation. We all should work, and we all doctors and nurses, all sweeper, ward boy, all healthcare workers are working very hard to chase this virus. Our policy is to chase this virus. Definitely, it's a different kind of situation. We never use this kind of PPE. Last 15 years of my practice, I never used this kind of PPE kit and all the things. But we should work, and society need doctors, society need nurses. So we all want ki we should work, and our chairman Bombay Hospital, who is a very philanthropic man, Mr. Bharat Kumar Tapadia ji, he wanted ki all doctors should work, and all doctors give their duty. They want to work. They want to fight with this coronavirus, and I am sure with this kind of josh, the situation you have seen in the ICU, with this kind of josh, we will definitely beat this virus, we will kill this virus, and we will chase this virus.
Thank you so much. Apurva, we'll also try and speak to more frontline workers here, the health workers, the doctors here who work round the clock only to give us the best possible service. So if we can just speak to you about your own personal experience, like Dr. Gautam Bhansali was saying, you all did not wear PPE kits for the last 15 years, and to adopt something which was very new, what were the challenges for you?
Challenges were getting accustomed to the PPE suit, managing patients, not knowing about the disease. We are learning with each passing day. But at the end of the day, the most satisfying part is when the patient is cured, he walks home, we bring a smile to everyone's faces. That's the only thing we all strive for, to keep everyone healthy and safe. And I'm sure with a collective teamwork, we're going to defeat this virus together.
Happy Doctors' Day to you. Apurva, we will just, show you that this is the ICU ward where we are. We will not really show the patients, but we want to show that what kind of medical infrastructure that these doctors had to really adopt to, with new sort of technology, with new, sort of things. We'll also try and speak to one nurse here, one sister who's been really working around the clock as well, and she is having a smile on her face. So this, we can really say that how important. Happy Doctors' Day to you. How difficult it is, to manage yourself in a PPE suit for 8 to 10 hours a day. What are the difficulties?
Actually, we are struggling work with this PPT because very hot inside. Anyway, it's not a thing. We know the society wants us, so we are struggling to work for the people. And also, I'm enjoying. We people are enjoying to work in Bombay Hospital 6 hours. And just now, and also I'm feeling like that I'm a Power Rangers, like a Power Rangers. That's all.
Thank you. So we'll also try and just speak to one last doctor here because we do not really want to disturb the patients out here. But we will just talk to one last doctor, know about his personal experience as well. And this is a hospital, Apurva, which has a 100-bed COVID capacity, including 44 ICU. And where we are, there are approximately 30 patients who have been admitted. And they are the doctors who work in shifts, at least 9 to 10 hours a day. Thank you so much for speaking to us. Happy Doctors Day. I know one day is not enough to celebrate what you all actually do for us, but just to, tell our viewers what exactly have been your personal experiences, because you all sacrifice your family life for us, you ensure that the COVID patients get recovered and they are discharged without any, problems.
First of all, thank you so much for realizing all these things. And most importantly, I will tell you that yes, it is a very, you can say that very different experience and all that we are feeling now. Because in my career of almost last 16 years, I have been working in the ICU. This is the first time we are wearing the PPE. And it is definitely not very pleasant experience. Plus, because of this COVID and all that, definitely the more panic is among the healthcare people, especially the doctors, nurses, and the ward boys and all. So we all are also worried about our families and this thing. Now, myself, for my wife and my kid who is 5-year-old, this thing. But we are trying to take over all the fears and all that and try to be more towards the patient. And as a Bombay Hospital team, we are trying best of our efforts to get them better. Our almost 500 plus more than patients have been recovered and almost discharged from this thing. Every day we are getting new cases, more of critical cases. We are trying best. Our team is trying our best. Our resident doctors, our senior consultant intensivist, in spite of the comorbid conditions and in spite of their age factor, they are still taking a risk and coming and seeing the patient and treating and giving their valuable opinions. Not more than that, yes. But I would also like to thank our management team who is always in the background, so don't come in. Other than the clinician, our whole management team is also working. So it's a Bombay Hospital team is working great.
So here we heard the doctors, the health, frontline workers who actually work every day just to see that we get the best of the services, best of the treatment. And one day is not only enough what they do for us. Back to you.
Absolutely. Rightly put, Disha. One day is not enough to celebrate them. It has to be done every single day for the work that they are doing. Mirror now, in fact, saluting every single Corona warrior, every single doctor who has been working round the clock, relentlessly helping people get better at this point. Many thanks, Disha, for joining us and giving us those beautiful voices there from on ground.